Gentlemen, let me ask you something personal. Are you waking up in the middle of the night, not once, but two, three, sometimes four times, and you're not sure why? Maybe you tell yourself it's just age. Maybe you've accepted it as your new normal. Maybe your partner has noticed before you did. But here is what the clinical evidence actually says. Nighttime waking in men over 60 is not random, and it is almost never just age. In the majority of cases, it is your body sending you 5 specific, measurable warning signals. Signals that have biological causes, biological explanations, and evidence-based solutions that most men have never been shown. If you are waking up at night and you don't fully understand why, stay with me. Because what I am about to share may be the most important health conversation you have had in years. I'm Dr. Emily Carter, a board-certified urologist with over 12 years of experience helping men over 60 reclaim their sleep, their vitality, and their overall health. When men come to me describing disrupted nights and exhausted days, the first thing I do is show them what the research actually says, because the evidence consistently reveals that these warning signs are not isolated complaints. They are connected, they are measurable, and they are addressable. Before we go any further, do me a favor right now. Hit that like button and drop a comment telling me where you're watching from today. Every week, I hear from men in their 60s, 70s, and 80s from all over the world who say this channel gave them answers their doctors never took the time to provide. I want to know who is joining us today, and if you haven't subscribed yet, please do it now, because every week, the research I share here could genuinely change how you feel. Now let me give you the full picture, because the stakes here are higher than most men realize. After 60, the male body undergoes a series of biological shifts that converge during nighttime hours in ways that are both measurable and significant. Testosterone production follows a circadian rhythm, peaking in early morning and declining through the day. But after 60, the overall baseline drops by 1 to 2% every year, and this affects sleep architecture directly. The prostate undergoes benign enlargement in the majority of men over 50, creating pressure on the bladder that disrupts sleep cycles. Cortisol regulation becomes less precise, making the nervous system more reactive to minor stimuli during the night. Melatonin production declines by up to 70% compared to younger decades, weakening the body's ability to stay in deep sleep. And cardiovascular changes alter nighttime blood pressure patterns in ways that create physical symptoms men feel, but rarely connect to their heart health. These systems do not fail independently. They fail together. And the warning signs they produce at night are your body's clearest communication that something specific needs attention. Ignoring them does not make them go away. The research shows, consistently, that addressing them early produces dramatically better outcomes than waiting until the symptoms become impossible to ignore. The first warning sign is frequent nighttime urination, waking 2 or more times per night to urinate. Biologically, this condition is called nocturia, and it affects more than 60% of men over 60, according to a study published in the Journal of Urology, tracking 2,114 men between the ages of 55 and 80. The mechanisms behind nocturia in this demographic are multiple and layered. The most common is benign prostatic hyperplasia, BPH, in which the prostate gland enlarges and compresses the urethra, causing incomplete bladder emptying. Because the bladder never fully empties, it reaches capacity again more quickly, triggering the urge to urinate repeatedly throughout the night. A second mechanism is the age-related shift in antidiuretic hormone production, the hormone that tells the kidneys to concentrate urine at night. When this hormone declines, the kidneys continue producing dilute urine through the night at a rate more typical of daytime. A third mechanism, often overlooked, is overactive bladder, a condition in which the detrusor muscle of the bladder contracts involuntarily, creating urgency even when the bladder is not full. Emotionally, nocturia is one of the most quietly destructive conditions I encounter in my practice. Men describe the cumulative exhaustion of years of fragmented sleep. They describe the frustration of lying awake at 2 in the morning, unable to return to sleep after a bathroom visit. They describe the effect on their relationships, separate bedrooms, interrupted intimacy, a quiet distance that grows from shared nights of poor rest. One of my patients told me, "I stopped feeling like myself about 3 years ago, and I never connected it to the sleep until now." Practically, the evidence supports several targeted interventions. Restrict fluid intake in the 2 to 3 hours before sleep, but do not restrict overall daily hydration, which should remain at 6 to 8 glasses before the afternoon. Elevate your legs for 30 to 45 minutes in the early evening. This mobilizes fluid that has pooled in the lower extremities during the day, allowing the kidneys to process it before you sleep rather than during the night. Reduce sodium intake, particularly at dinner, as sodium drives fluid retention and subsequent nocturnal diuresis. And critically, have a prostate evaluation. A PSA test and digital rectal examination are the baseline. The research is unambiguous. Early identification of BPH allows for interventions that dramatically reduce nocturia without surgery in the majority of cases. I remember David, 68 years old, a retired school principal. He came to me having accepted waking 4 times every night as simply what 68 felt like. His prostate-specific antigen was mildly elevated. His post-void residual, the amount of urine remaining in his bladder after urination, was 210 milliliters, nearly 3 times the normal threshold. He said, "No one ever told me to check that." Within 8 weeks of targeted intervention, he was waking once per night. He told me at his follow-up, "I forgot what sleeping through the night felt like. Now I remember." The second warning sign is waking with a racing or pounding heart, a sensation of the heart beating hard or irregularly during the night. Biologically, nighttime cardiac events in men over 60 deserve serious clinical attention. The phenomenon of nocturnal palpitations can arise from several distinct mechanisms. The first is sleep apnea, a condition affecting an estimated 34% of men over 60, according to research from the Wisconsin Sleep Cohort Study tracking over 1,000 men for more than a decade. During apneic episodes, oxygen saturation drops, the sympathetic nervous system activates acutely, and adrenaline surges, which produces exactly the sensation of waking with a pounding heart. The second mechanism is nocturnal hypertension, elevated blood pressure during sleep that is not captured by standard daytime readings. Research from the American Heart Association has documented that men with non-dipping blood pressure patterns, meaning pressure that fails to decrease during sleep as it should, face significantly elevated cardiovascular risk, and the symptom they most commonly report is nighttime cardiac awareness. The third mechanism is electrolyte imbalance, particularly low magnesium and potassium, both of which regulate the electrical conduction of the heart and are frequently deficient in men over 60. Emotionally, waking with a pounding heart is frightening in a way that few symptoms match. It activates a primal fear response. Men describe lying in the dark, heart racing, wondering whether they are experiencing a cardiac event. Even when the episode passes, the anxiety it leaves behind disrupts sleep for the remainder of the night and creates a cumulative dread of going to bed. I have had patients tell me they began sleeping in a recliner because they were afraid to lie flat. That level of fear, sustained over months and years, has a measurable impact on mental health and quality of life. Practically, the clinical evidence directs several urgent steps. First, have a sleep study. A home sleep apnea test is now accessible, affordable, and accurate. And identifying sleep apnea is potentially life-changing in terms of cardiovascular risk reduction. Second, request a 24-hour ambulatory blood pressure monitor from your physician. This captures your nighttime blood pressure patterns in a way that a clinic visit never can. Third, have your magnesium and potassium levels tested. Magnesium glycinate supplemented at 300 milligrams before sleep has documented evidence for reducing nocturnal cardiac palpitations in men with confirmed deficiency. Fourth, reduce or eliminate alcohol, even moderate amounts, as alcohol profoundly disrupts sleep architecture and triggers the nocturnal sympathetic surges that produce palpitations. I remember Michael, 63 years old, an architect. He had been waking 2 to 3 times per night with his heart pounding for over a year. His daytime blood pressure readings at his annual physical were consistently normal. His 24-hour monitor told a completely different story. His nighttime systolic pressure was consistently above 140, meeting criteria for nocturnal hypertension. He had sleep apnea with an apnea-hypopnea index of 22 events per hour, moderate severity. He told me afterward, "I went to my annual physical every year. I never knew any of this was happening." That is why this warning sign cannot be ignored. The third warning sign is waking with night sweats or intense heat, episodes of sweating that are not explained by room temperature or heavy bedding. Biologically, night sweats in men over 60 have a clinical significance that is dramatically underappreciated. The most common underlying cause, documented extensively in the endocrinological literature, is andropause-related testosterone decline. As testosterone levels fall, the hypothalamus, the brain's thermostat, becomes less precise in its temperature regulation. The result is vasomotor instability, sudden, unpredictable episodes of vasodilation that produce intense heat and sweating, virtually identical in mechanism to the hot flashes experienced by women during menopause. A study from the New England Research Institutes tracking 1,608 men between 45 and 79 found that men with testosterone levels below 300 nanograms per deciliter reported night sweats at nearly 3 times the rate of men with levels above 400. A second cause of clinical importance is nocturnal hypoglycemia, a drop in blood sugar during sleep that triggers an adrenaline response, producing sweating and waking. This is particularly relevant in men with prediabetes or type 2 diabetes. A third cause that demands immediate evaluation is infection, lymphoma, or other systemic illness, all of which can present with night sweats as an early or prominent symptom. Emotionally, night sweats create a particular kind of exhaustion and indignity. Men describe waking to damp sheets, having to change clothing in the middle of the night, disturbing their partners. They describe the cumulative impact on their sense of physical comfort in their own bodies. Many feel embarrassed to discuss it, because night sweats are culturally associated with women's health, and men have been given no framework for understanding why it is happening to them or what it means. Practically, the evidence is clear on the first steps. Have a comprehensive hormonal panel: total testosterone, free testosterone, SHBG, LH, and FSH, to assess the full picture of androgen status. Have a fasting glucose and HbA1c to evaluate blood sugar regulation. Keep a brief log of night sweat episodes for 2 weeks, timing, severity, and any potential triggers, before your physician appointment, as this data significantly improves diagnostic accuracy. In the meantime, the clinical evidence supports sleeping in a cooler room, between 65 and 68 degrees Fahrenheit, which reduces the frequency of vasomotor episodes. And avoid alcohol within 3 hours of sleep, as alcohol reliably destabilizes nocturnal thermoregulation in men over 60. I remember Thomas, 71 years old, a retired firefighter who prided himself on his physical resilience. He had been experiencing night sweats for 2 years and had told no one, including his physician. His total testosterone was 182 nanograms per deciliter, severely deficient. His free testosterone was correspondingly low. He said, "I thought this was just what getting older felt like." The clinical evidence says otherwise. His night sweats were a metabolic warning signal that warranted evaluation and treatment, not acceptance. The fourth warning sign is waking with leg cramps, restless legs, or a persistent need to move the lower limbs. Biologically, nocturnal leg cramps and restless leg syndrome, RLS, are among the most disruptive and least discussed causes of sleep fragmentation in men over 60. The mechanisms are distinct, but often coexist. Nocturnal leg cramps arise from involuntary contractions of the calf or foot muscles, typically during the transition between sleep stages. The primary underlying causes are magnesium deficiency, which impairs muscle relaxation, reduced peripheral circulation, which decreases oxygen delivery to muscle tissue during rest, and dehydration concentrated in the muscles after prolonged sitting or physical activity during the day. Restless leg syndrome, by contrast, involves a neurological urge to move the legs, accompanied by uncomfortable sensations, crawling, pulling, aching, that worsen at rest and improve with movement. Research from the Johns Hopkins Center for Sleep has established a strong association between RLS and iron deficiency, dopamine dysregulation, and peripheral neuropathy. A study tracking 849 men over 55 found that men with untreated RLS had sleep efficiency scores, the percentage of time in bed actually spent sleeping, that were 38% lower than men without the condition. Emotionally, nocturnal leg cramps and restless legs create a specific misery that men describe with remarkable consistency. The cramp that jolts them awake at 2 in the morning, requiring them to stand and walk the pain away. The 45 minutes of lying still while their legs demand movement, making sleep impossible. The next day's fatigue compounded by the night before. Over time, men begin to dread going to bed. They delay sleep. They lie awake in anticipatory anxiety. The sleep debt accumulates across weeks and months and years, and the downstream effects on testosterone, cardiovascular health, cognitive function, and emotional regulation are all documented and significant. Practically, the evidence supports several targeted approaches. Have serum ferritin tested, not just hemoglobin, but ferritin specifically, as iron stored in tissue can be depleted while standard blood counts appear normal. Ferritin below 75 micrograms per liter has been associated with RLS in multiple studies. Have magnesium levels evaluated. Take 300 milligrams of magnesium glycinate before sleep. The glycinate form specifically has the best evidence for muscle relaxation and sleep support. Stretch the calf muscles deliberately before bed. Standing calf stretches, 30 seconds each leg, as the research supports this for reducing nocturnal cramp frequency. Stay well hydrated throughout the day. And if symptoms are severe or persistent, a formal evaluation for peripheral neuropathy and dopamine regulation is warranted. I remember George, 66 years old, a former long-distance runner who had built his identity around physical capability. He described lying awake for 2 to 3 hours every night while his legs crawled and ached with sensations he could not ignore. His ferritin was 31. His magnesium was borderline low. He had been told at previous appointments that his blood work was fine. He told me, "I felt like I was going crazy. I couldn't explain it to anyone." Within 6 weeks of targeted supplementation and a bedtime stretching protocol, he was sleeping through the night for the first time in 4 years. The fifth warning sign is waking with anxiety, a sense of dread, or a feeling that something is wrong, with no identifiable external cause. Biologically, nocturnal anxiety in men over 60 is one of the least discussed and most clinically significant warning signs on this list. The mechanism is specific and measurable. During healthy sleep, cortisol follows a precise arc, lowest in the first half of the night, rising gradually toward morning to prepare the body for waking. In men over 60 with HPA axis dysregulation, disruption of the hypothalamic pituitary adrenal stress system, this cortisol arc becomes distorted. Cortisol rises prematurely in the middle of the night, triggering a low-level fight or flight activation that produces waking with anxiety, restlessness, and a vague but persistent sense of threat. Research from the University of California, San Diego, tracking 641 men over 55, found that men with abnormal nocturnal cortisol patterns had significantly elevated rates of depression, cardiovascular disease, and cognitive decline, independent of their daytime stress levels. A second biological mechanism is low testosterone itself, which has a direct relationship with anxiety regulation. The androgen receptors in the amygdala, the brain's fear center, are testosterone sensitive. When testosterone drops below optimal levels, the amygdala becomes more reactive, and nighttime cortisol dysregulation amplifies this reactivity into the experience of waking with dread. Emotionally, This is perhaps the warning sign that causes men the most suffering in silence, because it does not have a name they can point to. It is not a cramp or a bathroom visit. It is a feeling, and men have been conditioned to dismiss feelings, particularly ones that do not have an obvious physical cause. I have had men in my clinic describe waking at 3 in the morning in a state of free-floating fear, heart quickening, mind racing, for months or years, and never mentioning it to anyone. They assumed it was anxiety in the psychological sense, a personal weakness, something to manage alone. The clinical evidence says it is a biological signal from a dysregulated stress hormone system, and it responds to biological intervention. Practically, the evidence-based approach begins with a morning cortisol test, collected in saliva or blood between 7 and 9 in the morning, which is when cortisol should be at its natural peak. A 4-point salivary cortisol panel across a full day provides even more precise information about the cortisol arc. Request a full hormonal workup, including testosterone, DHEAS, and thyroid function, as all three interact with the HPA axis and nocturnal anxiety. In the meantime, implement an evening parasympathetic wind down. 30 minutes before sleep, perform 6 slow diaphragmatic breaths, dim the lights, eliminate screens. This has documented evidence for lowering evening cortisol and improving sleep onset and continuity. Phosphatidylserine at 300 milligrams before sleep has the strongest evidence base among nutritional supplements for blunting excessive nocturnal cortisol, with results in clinical trials appearing within 2 to 3 weeks. I remember Alan, 69 years old, a successful businessman who described himself as someone who had never had an anxious day in his professional life. He had been waking at 3 or 4 in the morning for 18 months, heart beating, mind filled with a formless dread he could not explain or control. His morning cortisol was low, paradoxically because chronic HPA dysregulation often leads to adrenal fatigue and low morning cortisol alongside elevated nocturnal cortisol. His free testosterone was at the bottom of the reference range. He said, "I thought I was losing my mind." He was not losing his mind. His endocrine system was dysregulated in a way that is common, measurable, and treatable. At his 3-month follow-up, he said something I have not forgotten. "I woke up last Tuesday and I felt like myself again for the first time in 2 years. I didn't know how much I had missed that." Here is your clear, practical action plan, beginning this week. Step 1. Track your nighttime waking for 7 days. Note the time, the symptom, and what preceded sleep. This data is invaluable for your physician and for your own understanding. Step 2. Schedule a comprehensive blood panel. Testosterone total and free, SHBG, PSA, ferritin, magnesium, fasting glucose, HbA1c, morning cortisol, and thyroid function. These are the baseline measurements that the warning signs we discussed today point toward. Step 3. Restrict fluids in the 2 hours before sleep and elevate your legs for 30 minutes in the early evening, starting tonight. Step 4. Begin 300 milligrams of magnesium glycinate before sleep. This addresses multiple warning signs simultaneously and has an excellent safety profile. Step 5. Implement the diaphragmatic breathing wind down 30 minutes before sleep, every night this week. These 5 steps cost nothing beyond a physician visit and produce measurable results within 2 to 4 weeks when applied consistently. I want to say something to you directly before we close. If you have been living with one or more of these warning signs, if your nights have been fragmented, your mornings exhausted, your days diminished, you are not simply getting older. Your body is communicating with you through specific, identifiable signals that have specific, evidence-based answers. The clinical data we reviewed today is unambiguous. These are not random inconveniences. They are measurable biological events connected to your cardiovascular health, your hormonal health, your neurological health, and your urological health. Addressing them early makes a documented difference. And your body, at 60, at 70, at 75, retains a remarkable capacity to respond to the right support, applied with consistency and with knowledge. You are not broken. You are not past the point of improvement. You are receiving information, and now you have the framework to act on it. If this video gave you clarity today, give it a like right now so other men who are waking up night after night and accepting it in silence can find these answers. Leave a comment below telling me which of these 5 warning signs you recognize in yourself. I read every comment and I respond personally because this community of men taking their health seriously matters to me. Share this with a friend, a brother, a father, a neighbor who deserves to know that disrupted sleep is not inevitable and not untreatable. And subscribe to this channel because every week I bring you exactly this kind of research-backed, evidence-grounded guidance. The conversation your doctor should be having with you at every appointment. You deserve full nights, strong mornings, and a body that works with you rather than against you. I'm Dr. Emily Carter. The warning signs your body sends you at night are not background noise. The research shows they are precise signals from systems that are asking for support. Listen to them, act on them, and give your body what the evidence says it needs. Take care of yourself, and I'll see you in the next one.